Hi, I'm Dr. Stazan Sina, and in this video, I'm going to talk about teen suicide, specifically risk factors and things to look out for if you suspect your teen is suicidal or depressed. At present, suicide is the third leading cause of death in adolescents aged 15 to 24 years old, which is an increase of about 6%. It's third behind accidents, typically automobile accidents, and homicide. It is the fourth leading cause of death in children aged 10 to 15 years old, which is a 100% increase from previous years. Although females tend to attempt suicide more often, males tend to die from suicide more often, particularly because of the means that they choose. They tend to choose more lethal means to complete the act. So obviously, this is a very serious and real issue. I think before I launch into some risk factors, I would like to say one thing. I've often had parents come to me and share with me that they're a little anxious about bringing up the issue of suicide with their teen because they're afraid that if they bring it up, it's going to plant the idea in their mind. Well, if your teen is depressed, they may or may not have considered suicide. If they are suicidal, obviously this is something they're considering. And the value of bringing up this conversation with them is that you can assess the situation and get them the support they need in a hurry. If you suspect that your teen is suicidal and it seems like an imminent danger, in other words, that it's highly likely to happen, then you need to call 911 and have someone intervene for safety reasons. The most obvious thing to be looking for is if your teen is feeling suicidal, that they've considered a plan and that they actually have the means to carry out the plan. This raises the likelihood that they're going to attempt a suicide. It raises the likelihood enormously. Okay, so let's talk about some factors to look for in assessing your teen and the potential for suicide. Okay, so let's start with the first one. Previous suicide attempt. What we know in the behavioral sciences, like psychology, is that quite often the best predictor of future behavior is past behavior. So, if your teen has had a previous attempt at suicide, they're more likely to make another attempt and to see it as a viable option. Likewise, if there's a family history of suicide attempts or actual completion, it also raises the likelihood of your teen considering this. So a previous suicide attempt is a victim of some sort of abuse. If your teen is the victim of some sort of abuse, like physical abuse in the home, or now in the media, you're hearing a lot more about bullying, they're more likely to at least consider suicide as a means to an end. So a history of aggression, abuse, or bullying. Is perfectionistic. Teens and adults who tend to be perfectionistic often think more in black or white terms. Things are all good or things are all bad. It speaks to a certain rigidity in the thinking, a fixed sort of thinking that lacks some flexibility. Folks who tend to be more perfectionistic may be more at risk for considering suicide, as it feeds into the notion of black and white thinking. Things are all good, things are all bad. This is the one answer that I have at my disposal. So perfectionistic tendencies demonstrates a decreased concern for self and may engage in high-risk behaviors. So this video is predominantly about teenagers. However, it's also applicable to adults and children. High-risk behaviors. Teens tend to be risky. So if you're seeing high-risk behaviors in your teens, it may not necessarily be an indication that they're suicidal, but it's something to tuck in the back of your mind. High-risk behaviors for teens may include things like being more of a daredevil, taking more dares from friends, running into traffic, jumping off of high buildings. In other words, having more of a blatant disregard for oneself and becoming injured. If you're seeing your teen being less concerned about their physical integrity and taking more risks or more injurious, that might be something to consider. Cutting on oneself. In future videos, I will discuss cutting as a coping mechanism. Although cutting in and of itself does not necessarily indicate that your teen is suicidal, and it does not necessarily indicate that your teen is attempting to commit suicide, it is also a factor to consider, as it does speak to more of a disregard for one's physical integrity and for one's body. So if your teen is cutting on themselves, this is a very serious thing, obviously, that you will need to get some help on, and it may be an indication that they're feeling suicidal or could feel suicidal down the road. Social withdrawal or isolating oneself. People who are more isolated tend to have less support. They tend to have tend to be more depressed, as they don't have people around them to rely upon. So if you notice your teen is isolating themselves more, or has a change in support, decreased social support, that is something else to consider. Decreased communication. If you find that you're just not able to talk to your teen as you once were able to, this is a cause for some concern. Now, although this is quite often in teenagers and not necessarily a sign of them feeling suicidal, you're going to consider this, especially if you're seeing some of these other factors. Underachieving in a number of areas. In other words, they're not experiencing the success perhaps that they once were, or are uninterested in perhaps pursuing some of their interests and attaining the success that they once had. One of the leading causes, according to the Center for Disease Control, one of the signs of potential suicidality is a plummet in academic functioning. Quite often in my office, in my practice, decreased in grades, problems at school are one of the first flags that a parent picks up upon when they give me a call out of something for concern that could be more indicative of something underlying going on. So decreased success or problems having experienced success and underachieving in a number of areas. Focuses on themes of death. As I discussed in my video on major depression, if your teen is listening to music with depressive themes, it doesn't necessarily indicate that they are depressed. Teens who are not depressed are unlikely to become depressed by this type of music, movies, or literature. However, if you're already depressed, you may tend to gravitate toward these themes more often, and it is also something to monitor. Substance abuse. Either your teens or perhaps an adult in your home abusing substances. Folks who tend to abuse substances often, not always, have some underlying depression. And it's obviously going to impair one's judgment, and it's more likely to raise impulsivity. People are more likely to act without thinking, to be less inhibited. So substance abuse is a concern. Experiencing a significant loss or the anniversary of a loss. Those times of year when people re-experience the anniversary of a loss can be a very sad and sometimes depressing time in one's life. So during these times, you would need to keep a closer eye on your teen, especially if they're experiencing a recent loss, particularly if it's someone close to them. This could often lead to unresolved grief, which can often lead to depression. Diminished interests in typical pursuits. In other words, those things that your teen once experienced interest in and was motivated to do, they simply no longer feel like doing it. I've talked about this also in my video on major depression. Another word for this is anhedonia, the lack of ability to seek pleasure or to experience pleasure. This quite often is a hallmark of at least depression. Giving away prized possessions. This is the one you hear a lot about. Um, someone who feels like life is meaningless. They're feeling kind of hopeless, that change isn't going to happen. You may see them start to give away things that you thought they would never part with. This is often a serious sign of feeling suicidal, not just depressed. Leaves a diary, drawing, etc. around to be found. I've had a number of parents over the years come to me after having found an essay that their teen had written about school, after coming across a text or something on Facebook that their teen had written or posted. And often this is a first red or orange flag that a parent will notice. I've often had teachers come to me and say that they've come across certain essays and have brought them to the attention of parents. Sometimes this is a sign of depression, sometimes it is not, but it's always something to tuck away in the back of your head. Expresses hopelessness or worthlessness. As I mentioned a little while ago, feeling as if nothing is going to change is certainly a sign of depression. And worthlessness, feeling bad or very negative about oneself, obviously could be a sign of depression as well. Relationships deteriorating or quality of relationships unsatisfying. So this goes along with what I spoke of before about isolating or withdrawing behaviors. They may experience their relationships as not very satisfying. And if you're feeling that way, you may feel alone, isolated, as if no one cares about you, and as if you have little or no support. Finds little meaning or purpose in life. This goes along with anhedonia. Those things that motivated them before or drove them before no longer serve that function. And they feel like they can be floundering or just kind of bouncing along aimlessly without anything to guide them, that serve as goals for them to grab onto, to motivate them. Poor impulse control. I mentioned this when I talked about substance abuse. People who have poor impulse control often make worse decisions, often find themselves in worse life situations and become anxious and depressed. Or they may act in certain ways that bring about consequences in the community, the police, or, if we're talking about high-risk behaviors, as I mentioned before, they have poor impulse control and they find themselves becoming injured and hurting themselves, and in situations that are going to affect their mood. Poor coping skills. Folks who just don't know how to handle their situation, their stress, don't know how to manage the situation well enough, are going to feel as if they just cannot cope. And this is more likely to lead to at least depression. Lastly, it's been identified that people who have a serious medical condition often become depressed and feel suicidal. And this ties into notions of hopelessness, things turning around, and seeing the light at the end of the tunnel. So serious medical conditions or chronic medical conditions or pain is definitely something to consider as a factor. So in this video, what I've tried to do is present you with some things to consider as you're talking to not just your teen, but to your child or anyone else in your life that you care about. There's no magic number here in terms of possessing 8 out of these 20 or so criteria that I've mentioned in order to qualify for someone who would be considered suicidal. You could possess 2 or 3 of these things and it'd be enough of a concern for someone or for you to act. So I hope this was informative, and I hope that you're able to put this to good use. Thank you.